One rotten tooth could become deadly. Ancient humans fought back with stone. That sounds dramatic, but a toothache in prehistory was more than an annoying pulse during dinner. There was no dentist to call, no reliable anesthetic, and no antibiotic waiting in a cabinet. Pain could stop someone from chewing, sleeping, traveling, or helping the group find food. If bacteria reached the soft pulp inside a cracked or decayed tooth, infection could spread into the jaw and surrounding tissues. Most toothaches did not kill their owners, but a severe abscess could turn a tiny hole into a serious threat. So survival had two levels: endure the pain today, then stop the damage from becoming worse tomorrow. The evidence suggests ancient people tried both. Some responses were simple and almost invisible. Others involve putting a sharp tool directly into the problem, and one newly studied tooth has pushed that story much farther back than scientists expected. To understand why anyone would volunteer for Stone Age dentistry, we first need to meet the enemy hiding under the enamel. Enamel is the hard outer shell, but it cannot heal a deep cavity like skin heals a cut. Under it lies dentin, while living pulp at the center holds nerves and blood vessels. Decay, heavy wear, or a fracture can open a path toward that pulp. Inflammation inside the rigid tooth traps painful pressure. A small damaged spot can then produce pain that seems to own your entire skull. Ancient teeth faced more than cavities. Grit wore crowns down, while gripping hides or fibers could chip them. Gum disease loosened their support, and accidental blows cracked enamel. A rough diet meant fewer sticky foods but more sand, stone dust, hard shells, and mechanical punishment. In other words, prehistoric mouths were not pristine advertisements for the paleo diet. They traded some modern problems for a different collection of terrible customer reviews. When the nerve died, pain might briefly fade, but the danger was not necessarily gone. Infection could continue around the root, where the jawbone sometimes preserves its signature thousands of years later. Because cavities often increased after farming, hunter-gatherers are sometimes imagined with flawless teeth. The trend is real. Fermentable carbohydrates gave decay-causing microbes more fuel, but averages hide communities, seasons, and individual disasters. At Taforalt in Morocco, 14,000 to 15,000 years ago, hunter-gatherers ate many acorns, pine nuts, and other wild plants. Cavities affected 51.2% of observable adult teeth, and 94% of adults had decay. That is a prehistoric dental emergency department. Processing starchy plants released carbohydrates that oral bacteria fermented into acids. Agriculture later expanded the problem in many places, yet farming did not invent toothache. Even with few cavities, people faced cracks, exposed dentin, worn crowns, and infected gums. There was no universal response. It depended on the injury, available materials, local knowledge, and whether the person could chew. Unfortunately, pain leaves no fossil. Archaeologists see the damaged tooth and healed bone, not the sleepless night beside the fire. The first response was probably less dramatic than surgery. A person could chew on the other side, choose softer food, remove trapped fibers, rinse, or apply heat or cold. Groups cooked, pounded, and shared food, so changing its texture was possible. A damaged tooth did not mean starvation if food could be softened first. These are reasonable behaviors, not photographed facts. Wood, fibers, and spoken knowledge disappear. Teeth preserve harder clues. Grooves between ancient teeth have long been interpreted as repeated use of toothpicks made from wood, bone, or grass. Some may indeed record attempts to dislodge food or soothe irritated gums. Newer comparisons found similar grooves in wild primates, so chewing and grit can create lookalikes. Archaeology has its own version of a suspicious dental X-ray, suggestive, useful, and not allowed to confess under oath. Stronger evidence appears when tool marks sit inside a diseased cavity in a pattern that natural chewing cannot easily explain. That is when coping begins to look like treatment. Plants may have offered relief, although the evidence is easy to oversell. Repeated experience could reveal that certain bark, leaves, or resins changed pain or swelling. Dental calculus, hardened plaque on ancient teeth, can trap traces of what entered a mouth. At El Sidrón in Spain, Neanderthal calculus held traces linked to cooked plants, yarrow, and chamomile. Another El Sidrón individual had a dental abscess and traces of poplar DNA and penicillium mold. Poplar bark contains salicylic compounds, while penicillium is the genus that later yielded penicillin. That combination sounds like a prehistoric pharmacy, but it is not proof of a prescription. The person may have consumed those materials for unrelated reasons. Mold is not a measured antibiotic dose, and traces cannot reveal intent. The narrow conclusion: Neanderthals consumed varied plants, some capable of easing symptoms. Pain relief may have bought time. It did not remove dead tissue or drain an abscess. For that, somebody had to confront the tooth itself. That confrontation now appears astonishingly early. In 2026, researchers reported a Neanderthal molar from Siberia's Chagyrskaya Cave, from an occupation about 59,000 years old. The tooth, called Chagyrskaya 64, had severe decay in a deep hollow reaching the pulp chamber. Microscopy and micro-CT showed demineralized dentin, rounded surfaces, and marks, unlike ordinary wear or burial damage. The team tested stone points on human molars. Rotating a small tip produced depressions and microscopic grooves like those in the Neanderthal tooth. Their conclusion was careful but remarkable. Someone intentionally drilled or scraped away diseased tissue. Smoothed walls indicate the tooth was used after the hollow formed. This was not decoration. It appears to be invasive caries treatment, currently the earliest documented in human evolutionary history. We cannot know whether the patient worked alone or trusted someone else with the stone point. Either option is uncomfortable. One requires extraordinary self-control. The other requires a prehistoric version of hold still. It was not a modern root canal, despite the tempting comparison. There was no sterile field, reliable anesthesia, or sealed filling. Opening the pulp might reduce pressure and remove infected material, but also cause pain, bleeding, contamination, or fracture. In experiments, stone reached the pulp in under an hour, though a living mouth would be far harder. Several overlapping depressions suggest repeated drilling positions or stages. Its maker needed fine control and a reason to continue through Siberia's worst appointment. Why risk it? Because the alternative was constant pain, poor chewing, and infection around the root. Once the nerve dies, pain can decrease, while bacteria remain active beyond it. Removing diseased tissue might bring relief without curing the infection. The evidence does not prove Neanderthals understood microbes. It shows they could locate pain, intervene deliberately, and endure suffering for possible benefit. That is practical medical reasoning without a white coat. Dentistry did not begin with farmers or even Homo sapiens. Among Homo sapiens, a clear early case comes from Riparo Villabruna in northern Italy. A young man buried about 14,000 years ago had a badly decayed lower wisdom tooth. Under magnification, researchers found chipping and cut marks deep inside the decayed area. Experiments suggested a tiny flint point was levered through the cavity to remove decay or trapped food. Unlike the Siberian molar, this mostly involved scratching, not deep rotary drilling. It was still an alarming upgrade from poking between two teeth. Imagine a tool usually reserved for hide or bone being reassigned to tiny mouth chisel. The marks occurred before death, but the procedure did not remove all the decay. It may have reduced irritation or made space for the opposing tooth while leaving the disease free to continue. That imperfect result matters. Ancient treatment was not magic, and temporary relief was not a cure. Villabruna shows people recognized a cavity as something they could clean out. Pain was not only endured, it was investigated. By the early farming period, evidence shifts from improvisation to a repeated technique. At Mehrgarh, in present-day Pakistan, researchers found 11 drilled molars from 9 adults, about 7,500 to 9,000 years old. Regular holes indicate deliberate drilling during life. Experiments showed flint tips could cut enamel when rotated with a bow drill, like drills used for beads. A cord drove the drill, while a tiny stone point did the unpopular work. 4 teeth had decay, while others were drilled for uncertain reasons. No fillings survived, so we should not invent them. Repeated examples suggest shared knowledge, not one desperate accident. Farmers often had more starch and cavities, but also crafts and tools adaptable to treatment. The bead maker and the dentist may have been the same person. One made holes in ornaments. The other made the customer regret breakfast. Mehrgarh shows a useful technique becoming tradition. Once removing diseased material sometimes helps, the knowledge can outlive the first brave mouth. Drilling removed material, but what about covering a sensitive tooth afterward? A 6,500-year-old jaw from Slovenia offers one answer. A worn, cracked canine carried beeswax over exposed dentin and part of the fracture. Chemical analysis confirmed the wax, and micro-CT showed it closely filled the damage. If applied during life, it may have reduced sensitivity while chewing. The catch is important. Researchers could not rule out wax added after death for another purpose. So it is a strong, early filling candidate, not a Neolithic dental receipt. Beeswax would not rebuild enamel or disinfect an abscess, and heavy chewing would wear it down. As a barrier over exposed dentin, it makes practical sense. It suggests a familiar sequence. Identify the painful surface, modify it, then cover it. That is closer to dentistry than waiting for the tooth to surrender. Other temporary plugs may have been tried and vanished without a trace. The record favors materials that survive 6 millennia, which is a very unfair product test. Most quick remedies would leave nothing for scientists. When treatment failed, the final solution was losing the tooth. It might loosen through disease, break away, or be deliberately pulled. Extraction sounds obvious, but is hard to prove in prehistory. A healed socket proves loss before death. It rarely reveals whether a helper pulled it, an injury knocked it out, or disease finished the job. Some cultures also remove teeth for ritual or identity, further complicating diagnosis. Pulling a diseased tooth could remove the pain source, but also fracture the root, tear tissue, or add infection. There were no specialized forceps, only hands, leverage, and whatever tools seemed least terrible. Survival after tooth loss depended on the remaining mouth and on other people. Cooking, grinding, and sharing softer food helped someone who could not chew normally. Healed jaws show some people lived long enough for bone to remodel after tooth loss. That proves survival, not exactly who prepared dinner. Support is plausible, but archaeology cannot name who held the bowl. The body and group did what dentistry could not: adapt after the tooth was lost. So how did ancient humans survive a toothache? Not through one secret herb or heroic extraction. They combined endurance, softer food, plant knowledge, cleaning, intervention, tooth loss, and help from others. The mix varied. Mild pain could fade, a cracked tooth remain usable, and a dead nerve go quiet. A dangerous infection, however, might spread, weaken, or kill. Most surprising, some humans did more than wait. A Neanderthal about 59,000 years ago appears to have had decay drilled from a molar. Later, Homo sapiens scraped cavities, drilled teeth, and possibly sealed exposed dentin with beeswax. These procedures were painful and risky, but they turned observation into action. Ancient dentistry began when someone realized pain's source could be reached, and then found another person brave enough to open wide. If you have a toothache today, choose a dentist over flint. Archaeology finished that experiment. Thanks for watching. If this trip through humanity's least relaxing medical history taught you something, like the video and subscribe. Your teeth will not care, but we will.